Dr. Ersin Erek from Acıbadem Hospital, Pediatric Cardiac Surgeon, is going to explain us what are the general treatments for pediatric congenital heart defect children in Turkey.
Thank you. Actually, one in 100 babies born with congenital heart disease. It's a great number, actually. Considering in Turkey, our birth rate is around 1,500 children in a year, and it means that 15,000 babies born with congenital heart disease. The treatment of congenital heart disease is basically surgical because it's an anatomical problem. It's a morphological subset, morphological problem of the patient. So the general treatment is surgery. But nowadays, today, other treatment facilities are increasing, such as catheter interventions, balloon dilatations, stent implantations, and even some hole in the heart may be closed with catheter devices. It's also increasing. But generally, many patients still needs surgery, and we perform around 300-350 operations in a year in our center.
So this is quite a huge number, and I'm sure most of the cases that are done is quite high-class operations like arterial switch,
Yes,
and
you are right. Actually, increasing facility of the diagnosis in congenital heart surgery in Turkey because of the high number of pediatric cardiologists all over the country. Today, we diagnose the patients as early as possible, even in utero. We usually know when the baby born, what kind of congenital heart disease is present at the moment. So we can take necessary measures just after birth, even before birth, and we can inform the families about the disease's condition and what can be done. It's very important. So approximately 30-35% of our patients are neonates.
Which is very important.
Yes, important. And 70% of our patients are under 1 year of age at the moment. We have very little number of patients who come to us for treatment in the late period. This is the usual approach in the world, as early as possible. All interventions and operations we perform as early as possible at the moment.
So it seems that here in the center, you and your team have an important experience in neonate pediatric cardiac operations, which will even let the mother to give birth here, and after that directly will be the operation. And there is a dedicated intensive care for the pediatric patients in this hospital.
Neonatal intensive care unit, pediatric intensive care unit, and cardiovascular surgery intensive care unit are present in our hospital. All of them are very important to care of the patients. Knowing the disease before birth is very important for the preparation, and also it increases the success rate of the operations.
Exactly. This was a point which I would like to also come. What is the success rate of and average success rate of the operations which are done in this center? You said that you are performing over 300 cases per year. Well, are we up to date with the world and Europe?
Yes. We for many years we analyze our own results annually, and we prepare a nice presentation, and we share our experience with our colleagues and everybody. All of them are open all the time. So the general success rate actually around 4-5%, but it's a very, very average number because some patients, some diseases, we perform almost 100% success rate.
Yes.
But some diseases, such as hypoplastic left heart syndrome or very many complex diseases, their success rate may be as low as 70%, maybe less for some patients. But the most important thing is to compare the results of index operations with the world. Index operations means ASD, ventricular defect, heterology of fallow, transposition of the great arteries, Fontan operation. Those kinds of operations, we know our mortality rate and we know the world's mortality rate, European countries' mortality rate, and we always compare our results with them. And fortunately, I can say that we have a very, very comparable results.
Very, very nice to hear that. So that is why I think Turkey is preferred from different countries.
Yes. Yes.
Generally, you are accepting patients from which part of the world in the center?
All around neighboring countries comes to us for the treatment of congenital heart disease. Actually, the history of congenital heart surgery in Turkey is quite old.
Yes.
And my professor was the first doctor who started congenital heart operation in Turkey in 1960, just after United States.
Yes.
Actually, he educated in United States and come back to Turkey, started operations, and all over the country are...
so he was a pioneer.
Yes, pioneer, and everybody, almost everybody is his student.
So he opened the path for all the eminent surgeons like you.
Yes, yes. That's why we have a great experience for many years. So our results, as I said, are good enough.
Okay, thank you very much for your
You're welcome.
Information.
You're welcome.
We know that for a parent it's very hard to decide and choose.
Sure.
And we believe that in Turkey, with such eminent doctors like you, we can supply them very high quality healthcare services. Thank you very much,
You're
doctor.
welcome.